We've all been there, haven't we? You get that call or letter before a medical scan and boom, no food or drink after midnight. It feels almost like a sacred rule.
It really does. It's so ingrained.
But what if, just maybe, for a lot of the scans we get these days, that rule isn't quite necessary anymore? Today, we're doing a deep dive into exactly that. Is fasting before scans, using modern contrast media, well, still needed?
It's a fantastic question, and the science has definitely been pointing towards a change.
I always found added stress, like on top of worrying about the scan itself. So maybe start us off, where did this fasting rule actually come from?
Right. Well, you have to go back a bit, to the 1940s and onwards. The contrast media they used back then, the high osmolar kind, they often made people feel pretty sick.
Sick how?
Nausea was common, maybe around 4.5%, and actual vomiting happened in nearly 2% of cases. The big worry, the real concern, was aspiration pneumonia.
Getting stomach contents into the lungs.
Exactly, a serious complication. So fasting became the standard procedure, sort of a safety net to minimize that risk. It just stuck.
Okay, that makes sense for back then, but things have changed,
Yeah.
right? What was the big leap forward?
The absolute game changer was the development of modern contrast media. We're talking about the non-ionic, low osmolar types. These are just much, much gentler on the system.
Gentler meaning less sickness.
Precisely. Far fewer side effects. Those emetic complications, nausea and vomiting, dropped dramatically. Some studies show incidence rates below, like 0.3%. That's a huge reduction.
Wow.
And here's the kicker. Massive studies, huge meta-analyses looking at hundreds of thousands of patients. One included over 308,000. They found 0 cases of aspiration pneumonia with these newer agents.
0 across that many people.
0. That fundamentally changes the whole risk calculation,
Absolutely. So, okay, if aspiration isn't the concern it was, what did those big studies find about nausea and vomiting? Did fasting still help with those?
This is where it gets really interesting. The evidence showed pretty clearly no significant difference. Nausea rates were about 4.6% whether people fasted or not. Vomiting was actually slightly lower in the non-fasting groups in some analyses, like 2.1% fasting versus 2.5% non-fasting, though not statistically significant overall.
Wait, so fasting didn't help and might even track with slightly more vomiting sometimes?
Well, one randomized trial actually did find significantly less nausea and vomiting in the group that didn't fast. It was something like 0.92% versus 2.86% in the fasting group. It pointed towards fasting itself potentially being a risk factor for feeling sick.
Huh. Why would that be?
It could be hunger pangs, maybe some dehydration, changes in stomach acid. Fasting isn't exactly a comfortable state physiologically.
Right. Okay, so the evidence seems really strong against routine fasting for these newer agents. Why is the don't eat rule still so common then? Are the official guidelines catching up?
Things are definitely shifting. It just takes time for old habits to change in medicine. But yes, major radiology societies like the American College of Radiology, the European Society of General Radiology, even the Korean Society of Radiology, they've updated their guidelines.
And what do they say now?
They generally state that routine fasting just for receiving modern intravenous contrast media is not recommended anymore.
That's huge. And that means real benefits for you, the patient.
Right, absolutely. Think about it. No unnecessary hunger or thirst. No worries about blood sugar dropping, which is critical if you have diabetes.
Yeah, and you can take your regular medications without disruption. It avoids delays, cancellations.
Yeah.
It just makes the whole process smoother and less stressful.
And, as we mentioned, avoiding fasting might actually reduce your chance of feeling nauseous. Plus, paradoxically, being starved can sometimes increase gastric volume and lower pH, which theoretically could make aspiration worse if it did happen, however unlikely that is now.
So it really sounds like a win-win.
Generally, yes. But, and this is important, it's not a total free-for-all. Fasting isn't gone completely.
Ah, okay. What are the exceptions?
There are specific situations where it's still needed. Certain scans of the stomach or bowel, for instance, where they need your GI tract clear for technical reasons to get good images. And crucially, any procedure that involves sedation or anesthesia usually still requires fasting for safety.
Got it. So it's not about all scans, just specifically about the routine use of modern IV contrast when sedation isn't involved. It's more nuanced.
Exactly. It's an evidence-based policy change targeted at where it makes sense.
And we're seeing this work in practice. Hospitals are actually changing their rules.
Yes. There are reports, like from one hospital that relaxed its policy. Over a year and a half, more than 27,000 patients didn't have to fast unnecessarily. And guess what?
No aspiration cases.
Not a single one reported. And importantly, the quality of the scans wasn't compromised at all.
That's fantastic. It really shows how medicine can and should evolve when the evidence is strong. It moves beyond just how we've always done it.
It really does. Understanding the evidence and applying it is key. Questioning those long-held assumptions, like routine fasting here, can make a direct, positive difference to patient care and comfort.
Makes you wonder, doesn't it? What other long-standing medical practices might be ready for a fresh look based on the latest research, challenging that traditional wisdom for potentially better, simpler, or safer outcomes?